One of the most frequent questions I get from my patients is, why isn't this being more used, accepted, reimbursed by insurance? They can't understand it when they see the results. My answer to them is that the problem is within the medical profession. The medical profession has failed to understand the science behind this therapy and to properly interpret studies, the data that's been generated. And a lot of this goes to the hyperbaric medicine community. They have defined this therapy very strictly as the use of 100% oxygen, at least 1.4 atmospheres of oxygen, and now most recently, as of last year, 2.0 atmospheres of oxygen. Anything less than that pressure and anything less than 100% oxygen, they don't have a name for. They can't explain it, but it's not hyperbaric oxygen. This is the most ignorant, backward definition and primitive understanding of what this therapy is. That is the main problem. The enemy is within here. It completely ignores over 300 years of the use of this therapy with pressurized air and widespread use, publications, and even its use for the introduction of hyperbaric medicine in the United States during the Spanish flu pandemic, where it was documented how patients dying were put in a chamber with pressurized air and it saved their life. But based on this definition, it has restricted the thinking so much that all of this evidence is completely excluded. And instead, it's focused on a narrow list of diagnoses that have responded to these higher pure oxygen pressures. And now it's been an issue of maintaining the perceived financial stability of the specialty by trying to tie all reimbursement to just those diagnoses and in the hospital setting. And what do we have? We have a confinement and restriction of this therapy that is limiting the vast application to so much human disease.